Welcome to this episode of Thrive Talks To. I'm Sourovi. In this episode, I'm talking to Professor Sally Brinkman. Sally is a social epidemiologist, as a professor at the University of South Australia and co-director of the Fraser Mustard Centre. Sally has dedicated her career to exploring the impact of society on children's development outcomes. Her work spans continents, and we'll be talking particularly about Sally's work in small island countries in the Pacific. Welcome, Sally. It's really nice to have you with us.
Thank you.
So, Sally, let me start by asking you about the importance of population level data. You've led the design and implementation of the Early Development Instrument for population level data across Australia. Could you tell us a bit about why this kind of population level measurement of children's development is important for researchers and policymakers?
I think it's important to differentiate between the different types of population measures. So you can have a population measure that, which is most common, around a survey sample, right? So you might do a household survey and you create a representative sample, select households, and then use it in that way. The other way of being able to do population measurement is what I would call a census-based approach. And this gives you quite different data, and it, I suppose, mobilises policymakers and communities in a different way. So the Australian Early Development Census, which is known as the ADC, is that population measure. So it's a census of child development. It's done once every 3 years. And the reason why it's important is because the data is publicly shared. So it's not owned by a Department for Education or a Department for Health. It's funded by the Department for Education, federal, but the data is available to everybody, and it's shared by geographical maps. So it means anybody can get onto the website and they can look at how well their community is doing. It's their children, so they engage with it quite deeply. And it also means anybody can make, they can action the data essentially, right? So we have community action groups, we have non-government agencies, local councils, all engaging with the data, and it's known as a key performance indicator for all three tiers of government in Australia. At a policy level, it also enables resource allocation. So you can really see, because it's a whole census, you can see minority population groups. You can see how they're doing. You can see small geographical areas, and then you can try and get your mix of universal and targeted services right. And where you do want to target, it gives you a really strong evidence base to be able to do that. And then having the commitment to undertaking the census every 3 years, it means you're monitoring over time. So the first census was back in 2009, and it's been every 3 years since then. So we have longitudinal data, which enables us to see different communities, how they're going, where there might be improvements, where there might not be. You can overlay a whole lot of services over the top of that, and you can evaluate policies from the community level right through to national and different services. The data is also linked into population-wide administrative data linkage systems, which is becoming increasingly popular across many countries. And this enables us to then actually undertake, say, for example, a randomized control trial. If you're wanting to do an impact evaluation, you can implement in some communities and not other communities. And then you can see through the linkage how the children are going through the ADC. So it's enabling that as well. So it's become an extremely powerful instrument for the whole country.
Now, there's a lot of debate about the right measurement instrument. And you worked on developing measures of child development and well-being that are both locally relevant as well as culturally appropriate while maintaining international comparability. So that's a lot to balance within a single instrument. So can you tell us what goes into developing instruments that can strike that kind of happy medium?
It is a challenge, I have to say. I suppose I would err on, if I have to choose, then I would prefer to have locally relevant over international comparison, although I get that international comparison is important. But in terms of being able to shift policy and engage community, I think locally relevant is clearly important. Countries need to be able to own the instrument and really value it. And I found the process of either creating new or adapting an existing instrument in a country, that actual process in itself is mobilising in its own right. So, and at the end of the day, there are some aspects of development that are universal, and there's only so many ways you can ask the question, right? Like, I mean, I don't know, can a child hold a pen or a pencil? Does a child know how to make friends? There are some, basic things that are pretty universal that pretty much everybody wants to see in children across the world. So the way I tend to start is generally when I first engage within a country, then we tend to sort of get a whole group of key stakeholders together, and that would include people from the different agencies, so health, education, social protection, all of the major players, plus some key non-government agencies as well. And then we start the conversation around, well, what domains of development do you think are important? And that's generally your standard ones, your social and emotional, your language and community communication skills, sometimes general knowledge, physical development. But then you can get into some interesting ones like spirituality, cultural knowledge, sort of some of the different aspects of social development around respect within cultures and engagement with community and culture. So then once we set on the domains, then it starts a whole conversation around, well, what would you expect to see in your children to demonstrate those domains? What sort of skills are you looking for? And then I tend to go away and I match the items that have been raised with whatever is out there in terms of international comparison, that I know, which items within existing instrumentation work well. And then for those that we don't have anything for, then essentially we create a new item bank. And then you go through the standard process of piloting. So that's, that sort of tends to be the way I've gone about it. And where possible, I always try and align with the SDG items. So for early childhood, 4.2 anyway, it's the UNICEF mix ECDI items, and so where possible we try and include them. And then you tend to, if you can include local departments and agencies in the data collection process, then you're building capacity and you're mobilising around that instrument, and then people tend to be far more invested in the outcomes of the data, and then you sort of mobilising communities through that process. And yeah, most of the instrumentation in most countries that I've used, we've taken that census-based approach. So particularly in the Pacific, which means that we then go out, and so in the Pacific, reciprocity is really important. So if you're collecting data from people, then there is a real expectation that you'll be giving back in some way. And so we present those results back at exactly that same level that we collect the information. So we go back to community, we bring the local parents and families together, we present the results in maps, so it's really sort of simple and easy to understand. And we tend to sort of use the opportunity to talk about the importance of early child development and the sorts of things that you can do at home, as well as, advocating for preschool, etc., in that process.
Thanks a lot, Sally. That actually really nicely brings me to the challenges of accessing and using tools. So, practically speaking, let's say I were working in a Ministry of Education in a low income country, interested in establishing a baseline of child development indicators in my country. What are likely to be some considerations for me to bear in mind? Are there some existing tools that are freely available that I can use, or are they mostly licensed and behind paywalls, so therefore costly for me to access?
I mean, it's been wonderful over the last, I suppose, 10, 15 years. There has definitely been a movement towards more public good instrumentation. Having said that, there are some perfectly good instruments that are licensed as well. So I think it ends up becoming sort of, what do you want? Do you want an instrument that has already been validated, it's been used internationally, but then I suppose you don't have your ability to adapt locally. Many of the licenses require intellectual property data, often is held by the developer of the instrument, be that a university or a large-scale publication firm. And then there's also costs associated with training, and that can be both for the licensed instruments that are you have to pay for, as well as actually some of the free instruments that are available. In terms of the free instruments that are available more recently, so in the younger years, so 0, from birth up to the age of 3, there's now the GSED instrument, Global Scale for Early Development, by the World Health Organization. That's freely available, and it's relatively new, and we've started using that in Kiribati, and it's been an interesting process. And then, as I mentioned before, there's the UNICEF Mix ECDI, which can be embedded in any survey items, household surveys. There's the REAIM instrument, which is published through the World Bank, that's free and that you can bring into household surveys as well. Yeah, they're the main ones that I can think of, but there's others as well. Like Credi is another one. So yeah, there's quite a few out there. One other thing to consider, I suppose, is the idea of the population measure versus a screening assessment and diagnostic. So there's lots of health instruments that are really used at that individual level to determine whether a child has a developmental delay or not, or disability. And then if so, then the expectation is then the child will be referred on to either allied health professional or a pediatrician. And of course, in many countries, those services are not easily readily available. So there's some ethical considerations around your choice of instrumentation as well, whether it makes sense to go down that individual diagnostic or not. I tend to advise that if the services aren't available, then sort of population measures are probably the safest way to start building a system, and you can bring in the diagnostics, as you build the evidence for investing in early childhood. So it sort of becomes a staggered approach. So you're not saying not doing it, but maybe start with the population first. Then, there's the instrument that I developed called the ECI, which is, freely available, and anybody can adapt that as they want. Again, with the instruments that are available, even the free ones, your ability to adapt and change really depends on some form of negotiation with the developer. There are very few instruments that are just freely available and you can do what you want with. So the ECI is one. One other really good examples is the strengths and difficulties questionnaire, which is, freely available for anybody to be able to download and use. And there's an expectation that you follow the criteria, but there's nothing to hold people to it. Whereas some agencies have stronger requirements. We have to register, etc., etc. And I think the most important thing is you want to be able to have something that is going to work for your context. Ideally, that you can own yourself, so the IP is retained. You can work with the data, and I think if we're wanting to see systemic change and advocacy around early child development, then if we make instruments too complicated, too difficult, and not having the countries be able to own and see it as their own, then you're just creating all these different barriers. So for the ECI, it's now being used in about 15 countries. There are some countries that have used it that I don't even know about. For my own use, I've used it in about 8 or 9 countries now, and it's different in every country because we've gone through that whole adaptation process. And I'd say probably maybe 65 to 70% of the items are the same everywhere, very similar. And then you get the local adaptation where you get the changes. But we've gone through, the process of reliability and validity in each of those countries. And in each one, we've been able to validate well.
Thanks a lot for that, Sally. So we met when you joined the Thrive program as the principal investigator for Kiribati, which is a small island country in the Pacific Ocean. I've always had so many questions about your experience of working in Kiribati, but sadly not enough time. So could you maybe give us a taster of what's been your experience of working on early childhood service delivery as well as measuring children's well-being in a country like Kiribati, and whether there are particular unique challenges in small island countries when it comes to early childhood development?
Yeah, I have to say it's been an honour working in Kiribati over many years now. I think I first started working there back in 2013, 2014, which is probably just starting to show my age more than anything else. But it's been a wonderful journey of learning for both myself as well as, I hope, of benefit to the country as well. But when I first engaged, it was really through a World Bank project called the Pearl Program. And the aim was to develop early childhood monitoring. So we went through the process like I explained before, and we went through that same process in Kiribati. And the country really engaged in it. We did the census data collection, so every single 3 to 5 year old across the whole country. It's one of the very, very few data collections in Kiribati that goes to all the outer islands. So there's 23 outer islands in Kiribati, and the amount of time that it takes to get to some of them is quite long, 15 hours by boat. There's only 3 that you can get to by plane easily. And so, yeah, undertaking field work with a census approach is quite a challenge just in terms of transportation and the amount of time that you need to dedicate to that. But what was amazing was because it was such an undertaking, and because in Kiribati there's a process that you have to go through when you do any data collection. You have to speak to essentially what you would call a local council. In Kiribati it's called the Manieba. So you go through and you meet with the Manieba. You have to explain the study. You essentially have to get their permission, and there's quite there's a process to go through before you get sort of approval, essentially, to be able to undertake the data collection. But through that, again, you're engaging community through that process. And the way the political system works in Kiribati is the local Manayeba, the heads of the Manayeba in each of the different islands, is represented in Parliament. So there's a very strong link between community and the government change makers, essentially. And that's a real positive when you're trying to mobilise. So when we undertook the initial data collection and then we presented the information back to communities in the maps, there was quite a bit of engagement across the whole country. And over time, that actually led to the impetus of the inaugural National Early Child Development Policy, which is wonderful. So Kiribati now has an early child development policy that UNICEF and MFAT, so New Zealand Aid, helped to support, funded the support of the development of that and the consultation associated with that. And that ECI is considered the primary outcome measure to be able to evaluate the policy against, which is also quite nice to see that level of engagement and the processes associated with that. So so there's some challenges, of course, in Kiribati, but the rewards are great because you really do see action. The main issue with Kiribati, of course, is climate change. And so Tarawa, which is the main island, which has about 50% of the whole population of the country. So the country has about 120,000 people across all 23 islands, but about 50% are in Tarawa. The highest point in Tarawa, which is a series of about 16 islets, is 3 metres above sea level. So it's extremely densely populated on that main island. It's very real. And so when thinking about supporting children and trying to enhance child development in Kiribati, you sort of come at it from the angle of clearly trying to support the children for the future of Kiribati, but also, the likelihood that many of those children are going to, because of climate change, end up being refugees in different countries. You want to be able to provide as much of the skills and build the capacity as much as possible so that they can thrive in Kiribati, but also thrive in other countries in the world should, they have to move or choose to move. So there's some urgency associated with that, I think. Yeah.
Thank you. That's very humbling to hear. Also very, very, very interesting. Thanks a lot. So my final question, just to end on a hopeful note, is could you maybe share with us an example from your career, perhaps one that inspires you and is from your own work or from someone else's, when data and research on early childhood has impacted policy decision making and quite directly made a positive impact on children's well-being?
Mm-hmm. Yeah, well, I mean, Kiribati is clearly an example because, the initial monitoring work led to the National Early Child Development Policy and, actions have occurred since then. So that's been great. I think probably the greatest success as such, clearly still ongoing work, but would be Tuvalu, which is another country in the Pacific, also a small island state, and considered the most threatened country in terms of climate change in the world. It's small population, only 11,000 people across 9 islands. So it has some unique challenges in that regard as well. And in the middle of the Pacific, basically halfway between Australia and America. Not so easy to get to. But yeah, it's been amazing working with that country. And we also we undertook the ECI underneath that same World Bank Pearl program. What we found with the initial results, so back in 2014, 2015, was extremely high stunting rates, and that had never been identified in Tuvalu before. So through the ECI, we measure the child development, but we also take basic anthropometrics as well. And so we were able to identify this as an issue. So physical well-being in terms of child development was not good, as well as the high stunting prevalence. Because this was quite new, it was also the understanding or even just knowledge of the word stunting was not clear. And so there was quite a bit of communication with the government to try and, I suppose, help them understand what stunting is, why children end up being stunted, what are the root causes of stunting. And of course, they're varied. But for Tuvalu, it's mainly, variety of foods, poor nutrition, sanitation issues, and also, sort of high prevalence of things like worms and, etc. So lots of different potential causes. Anyway, the government was extremely concerned by the results, and I was asked to put a cabinet paper together, which went up to the Parliament, and we presented the results in Parliament. The data was disseminated back to all of the communities, so just the same as in the other countries, we sort of had the geographical mapping, so each of the different islands, they could see how their villages were going and how they were going in comparison to other islands and other villages across the whole of the country. And so we were able to identify some villages with stunting rates above 60%. Prevalence is above 60, which is extremely high. And so anyway, through a whole process, because Cabinet had engaged deeply in it, there was a lot of local action, actually with limited donor support. And it was really through this community mobilisation approach of presenting the data back to community, but also presenting why and the sort of solutions that were possible given the context. And so things like a food sin tax for bad foods, like cheap, 2-minute noodles were put on. Little community gardens in the different schools across the country started up. There was a whole lot of different things that was all community-led action, which was amazing to see. And then Tuvalu, on the basis of these results, actually requested international development assistance funding, so IDA funding for human development. Tuvalu was the first country in the Pacific to request IDA funding for human development rather than infrastructure. And it was on the basis of the ECI results. And that has been phenomenal to see. So the IDA funding became available. The country ended up getting about 14 million, which, for a population size of about, 11,000 people is quite a bit of money for early child development. And so, over the last 5 years, I've been able to be part of that project and see the implementation of different interventions and support.
Thanks a lot, Sally, for talking about not just your experience, but also your passion for robust measurement of child outcomes and ultimately using it to study and improve children's well-being. And thank you for listening again. Goodbye.